Okay. Kia ora, everybody. Thank you so much for joining us at this super exciting panel. It's super exciting for us panelists. We're going to talk about how to engage hard-to-reach energy users, and we're going to talk about it from an international perspective via this hard-to-reach task that I'm leading for the Users TCP by IEA. And I just want to say a big thanks to BECC for being a wonderful conference as usual and for giving us the opportunity to provide these international perspectives and hopefully answer a whole lot of your questions and have a good chat with everybody. So I'm gonna try and figure out how to get my cursor going. And very quickly, I just want to let you know that even though the Users Technology Collaboration Program sits under the International Energy Agency Secretariat, it is functionally and legally autonomous. So the views and findings don't necessarily reflect that of the IEA. So our hard-to-reach energy users task is an international research collaboration. It focuses on a very distinctive and important audience segments, the hard-to-reach energy users in both the residential and non-residential, mostly commercial sectors. And it is a continuation of the Task 24 research that we've done since 2012, which focused on behavior change in DSM. We created a shared definition for hard-to-reach energy users. It is very broad, as you can see, and that is on purpose. Because most people think of the hard-to-reach as low-income households who live in energy poverty, but it's a lot more complex than that. For example, energy users who hard-to-reach can also be those very high-income households who use a lot more energy. They have a lot more potential to change, but they may just not care, or they could be building operators in big commercial buildings who have a lot of power over energy use in their buildings, but may not feel empowered by the organizational leadership to save energy. And so when we started this task, our hypothesis was that it was about a third of energy users who were hard to reach. We thought that was very high, but then we actually really delved into this audience characterization and size estimates, and we realized it's probably more like 2/3 or 3/4 of energy users in the world who are deemed as hard to reach under our very broad definition. Vulnerable households are not just those who are low income and who are in energy poverty, but also those who suffer from various intersectionalities like minority status due to gender, age, race, ethnicity, or disability, living in geographically remote locations, or being otherwise stigmatized, criminalized, or illegitimized by society. And so we're talking about a really huge number of energy users, and the case studies that we're discussing today are really hitting a whole lot of those different audiences, which is very interesting and something that you don't see too often because the focus is so much on low income. So our shared goal, we've also created with our countries, and I just want to draw attention to the middle of the Venn diagram, because I was so happy to see the extreme focus that BECC has this year on equity and energy justice, because I think it is super important. I'm really glad we're starting to talk about it, because one of the issues we have, of course, including with the hard-to-reach terminology, is that it seems to be putting the onus on the energy users rather than us behavior changers, as we call ourselves, who are charged with motivating and engaging them in energy efficiency and behavior change and conservation activities. And so our goal is to help identify and characterize them, including the underlying structural issues that cause inequity and stigma, and to figure out how we can help behavior changes to best engage them, whilst also serving those important equity and energy justice needs. And I just want to highlight that I very much acknowledge how difficult it is for energy efficiency professionals or behavior change professionals to talk about underlying systemic and structural issues like centuries of racism and colonialism that may have been the cause for inequity and stigma and injustice. But it is really important that we start. And as we heard at the first BECC panel on equity, it is a multi-generational progress, and we're just starting to take the first few steps. But it is, the more we have conversations like this, the more we are going to move forward. And I think that's really good news. Just a very quick shout out to our absolutely brilliant participants and collaborators. We have 3 financially participating countries, including Aotearoa, New Zealand, Sweden, and the US. And then we have 2 co-financing countries with Canada and the UK. We also work really closely with the Fuel Poverty Research Network, which is chaired by our Chief Science Advisor, Professor Amy Ambrose of Sheffield Hallam University, and the wonderful Beth Carlin from the American Sea Change Institute, who you all know and love. And it's our collaboration with the Sea Change Institute that have led us to co-creating the research process that we are testing and validating in this task. It's called the Building Blocks of Behavior Change. I put the link to the white paper down there. And what we did, we followed this process in our research task, and we're also going to talk about it. We followed it also as the research methodology for the case study analyses. So in year 1, we focused on a discover. We did a landscape and stakeholder assessment, very in depth. We looked at our why, we created our shared goals and objectives. We also looked at the define phase. We delved really deeply with this beast that I'm going to talk about in a second, this giant book that we wrote on audience characterization and what target behaviors have usually been addressed when looking at the hard to reach and all these various audiences. And then what we're talking about today is the design phase, where we're really looking at engagement strategies and delivery of various hard to reach, of various programs reaching the hard to reach, and how they worked around the world, what worked, what didn't. And then in year 3, which we started, we're actually deploying some field research pilots in Aotearoa, New Zealand, and hopefully also in Canada in the field. So the beast is this giant 250-page plus oeuvre where we really try to characterize the various hard to reach audiences in depth, and we've fed in a whole lot of survey and interview data and outreach to our networks, but also over 1,000 publications. We're still trying to publish it as a book. Danielle is helping me with that. It's been an ongoing process. However, I'm happy to share it if you're interested confidentially. Some key findings from this big work was that even though the most commonly mentioned hard to reach audiences are very much low income households, but also renters and SMEs, the ones that actually have the greatest energy saving potentially are pretty much the flip side of that, which is high income households, the landlords, both commercially and residentially, and the building operators of large commercial entities. The most interesting to non-energy stakeholders who've done a lot more work on hard to reach populations are the disabled, the stigmatized, the geographically isolated, and some of the case studies that we're discussing today are looking particularly at those audiences who are often a bit ignored in the energy efficiency world. As I said, the audience size estimates are a lot higher than what we thought, and that's something we should all take very seriously and think about. The COVID-19 impact on them was massive, particularly on those vulnerable households, on renters, and also on small businesses. And the biggest research gaps that we found in our gap analysis was the commercial sector outside of office buildings, SMEs, not really looking enough at multiple benefits and impacts, and how we can actually flip the lens that we're addressing the hard to reach populations through them, such as the health lens. SME, sorry, Jamie's asking, SME is the non-American way of saying small to medium enterprise instead of small to medium business. It's SME or SMB, apologies. We're also not looking at enough at certain demographics, particularly around age, gender, and race. We are hardly ever really doing proper psychographic and needs analysis assessments of these audiences. And so they're not only hard to reach, they're also underserved and under-researched by us behavior changers in industry, government, and academia. And energy injustice, inequity, and stigma are key themes that need to be addressed much more urgently, and on these target audiences and with these target audiences. So to the case study analyses that we're talking about today, we had we collected them from 8 countries all around the world, 22 case studies, between 1 and 5 case studies per countries. In the residential sector, what we asked our case study authors to do is to focus on low income audiences with intersecting vulnerabilities, and they did. So we looked at everything from manufactured housing and renters in the US to Indigenous people in Canada and New Zealand, underlying mental and physical health conditions in the UK, in Aotearoa, the elderly. We looked at pregnant or single mothers with small children in Aotearoa, New Zealand. We looked at rural and remote communities, both in Canada and in Scotland, and at how to address frontline staff. And then in the commercial sector, we focused on small businesses specifically. We used a standardized methodology. We used the ABCDE blocks of the building blocks framework, and we created a template for all of us for the case studies. And then we also created interview questions that we used to interview in depth the program managers of the various case studies that we reviewed. There's the link to both of those here. And these case studies will now be synthesized, analyzed, and then published in a peer-reviewed cross-country case study comparison next year. So finally, you get to meet our brilliant panelists. Miguel Macias Sequeira is a PhD student at Sense Nova University of Lisbon. He's researching the role of hard-to-reach energy users in a sustainable, just, and inclusive energy transition. Amy Seabrook is a program manager at BC Hydro, where she designs and delivers energy efficiency programs with and for Indigenous and remote communities. And she's a great resource. If you have any questions, please do contact her on that. Danielle Butler is an absolute star. She's a senior research and policy officer for the UK's leading fuel poverty charity called National Energy Action. And she's also a trustee of the Fuel Poverty Research Network, which if you're interested, like that is a massive, really good resource. Join the FPRN, because there are hundreds of people who are just, fuel poverty is their bread and butter. Her work cuts across research, policy, and practice, and she's committed to driving forward efforts to ensure homes are spaces where people feel happier, healthier, and safer. Simone Maggiore and Anna Realini are researchers at RSE, which is a government-funded research institute in Milan, and their research is focused on different aspects of energy efficiency, including the issue of energy poverty and energy vulnerability, and they participate on EU-funded and national projects on these topics, with the aim to improve energy efficiency of the buildings, raise awareness in their occupants, and to guide the policymakers. They also represent Italy in the IAA Users TCP, and Simone is my favorite ExCo member, I have to say, and has been for 10 years, and he knows that. So I am Dr. C. Rotmann. I lead the Hard to Reach task. I'm in Wellington, Aotearoa, New Zealand, and I have written the New Zealand case study analysis. And people who know me know that I'm originally a coral reef ecologist, and I take my ecological lens very much into the socio-ecological world now. And I've been harping on about this at the international level for a very long time. So here are our case studies that we discussed today. They're not all of them. Sweden, the US, and the Netherlands are not there, but I put the link through to the IAO website where you can find all of them. And here are the links to each of our case studies. And we're now going to go very quickly into each of them, give you the quick kind of headlines of the objectives and the main results, and then we're going to start into our questions, and you please start engaging in the chat with us, and we try and have a dialogue. So we're starting with Aotearoa, New Zealand. I only looked at the residential sector there because fortunately our government is focusing really strongly on energy hardship. Unfortunately, that means that there isn't much work that's funded for small and medium businesses. So what I did is I looked at energy hardship work from different behavior changer perspectives. So I looked at a big cross-agency government-led initiative called the Healthy Homes Initiative. It uses trusted community providers to provide warm and dry and healthy housing for very specific, very vulnerable target audiences, pregnant women and families with very young children that suffer from respiratory illnesses, have been hospitalized, particularly with rheumatic fever, and who have at least 2 of the social investment risk factors, such as domestic violence or extreme poverty. So I just saw today in the news it's absolutely shocking. New Zealand is the only OECD developed country that actually suffers still from rheumatic fever. US and Canada and Europe have managed to stamp that out pretty much after the Second World War, where they improved the housing stock. It is still very high here, but only in Maori and Pacifica communities, which is a shocking bit of racism that is underlying our colonial past, and also thanks to the UK, our terrible housing stock, which is pretty much the worst in the OECD as well. And there is a direct connection. And what I saw in the news today, and what is really good news actually, is that for the first time, a landlord has been fined $40,000 for putting a young immigrant family through completely uninhabitable housing conditions, and the child now is crippled and suffering with rheumatic fever and probably disabled for the rest of her life, which is shocking. $40,000 is nothing, but at least it's a start. So there's a big problem in New Zealand. Energy Made is industry-led by the Energy Retail Association of New Zealand. They also deliver in-home energy coaching, but they are focusing on financial and budgeting managers in low-income communities, and they're particularly focusing on reducing the energy bills, switching them to different tariffs or providers, and also providing warmer homes. And finally, we looked at a community-led program by the Sustainability Trust. The Well Homes program is basically the bottom-up way of implementing the Healthy Homes Initiative in the Wellington region, and then Warm Fuzzies is basically the catch for, because Sustainability Trust is a social enterprise, and so the money they make from insulation subsidies from the government, they put towards social initiatives to help those that do not meet the very strict eligibility criteria for healthy homes or warmer Kiwi homes. Government initiatives, again, they're doing in-home advice. Again, they're very much around building on pre-existing knowledge and energy behavior and linking them with government programs. And I've mentioned it quickly, but here is some statistics that are absolutely shocking at how big the racial component is in making those households more vulnerable. Structural and functional crowding or overcrowding is one of the biggest issues, as is our really poor housing stock. Even these programs are run by stakeholders with very different mandates and perspectives that target very similar vulnerable whānau. They're using similar methods. They're using trusted community middle actors. They train them in home performance advisor training. They focus on the most vulnerable families, like those with sick children and pregnant mothers. They focus on poor housing and functional and structural overcrowding because they know that those are the underlying issues. Well, the structural underlying issues are racism and colonialism, but they really try and at least deal with some of that extreme causes that we have now. So I'm going to hand over to Amy, who is focusing on Indigenous populations in Canada, but she'll also give us a little bit of an oversight into the small business program.
Thanks, Dee. And certainly cut me off if I go too long here. Hi, everyone. I'm Amy Seabrook. I'm with BC Hydro. We're a Crown Corporation and public utility in the province of BC, British Columbia, west coast of Canada. And I'm coming to you from the traditional, ancestral, and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh nations. I will only actually speak to BC Hydro's Indigenous Communities pilot, not to FortisBC's Indigenous Communities program. This pilot was something that we did in 2017 through 2019 to better engage with Indigenous communities that we serve and to explore some of the barriers that they experience with respect to energy efficiency, energy conservation, and really to work quite closely with them to try to understand those barriers and figure out ways to address them. And so, you know, we took a pretty broad view of the pilot activities, did a whole slew of different things ranging from, you know, sort of information sessions and kind of community engagement to community energy planning exercises to supporting positions within Indigenous communities to develop some capacity and knowledge within the nation around energy efficiency and conservation and to support their members in advancing energy efficient activities. Actually doing some home energy upgrades. So the audience, you know, we have over 200 distinct First Nations communities in British Columbia. So we tried to work with a real sort of variety of them. We by no means worked with all 200 in this pilot, but we did work with communities that were both on grid and off grid. So we do serve a number of remote communities in the province through a mix of renewable energy and diesel generated electricity. So we had participants in the pilot from rural and remote, on grid, off grid, all different sort of climate regions and geographies of British Columbia, from the north to the coast to the southern interior. So real kind of cross section of Indigenous communities. The barriers, I mean, we went into the pilot with some hypotheses around what the barriers were, affordability, accessibility of some of these goods and services, given their rural and remote locations of some of these communities. But maybe I won't go into detail. I mean, one of the biggest barriers that we've encountered and continue to encounter and will continue to encounter is trust. Certainly not a unique barrier with the hard to reach audience, and something you'll probably hear from my other fellow panelists, but certainly something that is really prevalent here, particularly with Indigenous communities, because of the history of dispossession and marginalization by settler governments. BC Hydro's got a complex and a kind of long history with Indigenous communities in the province. So we have a robust Indigenous relations team in my company, and we have relationships. We have relationship leads for every Indigenous community that we serve. So it wasn't so much that we couldn't reach them, but they were certainly underserved by our DSM program. So this pilot was really just an opportunity to try to work more closely with them, to educate ourselves on what the barriers were that they were experiencing and we were putting up. And so yeah, I don't know how much I should go into the activities themselves, but maybe I'll just give an example quickly, and then in the discussion we can elaborate if people have questions. But one of the things, kind of building on that barrier of trust, was in trying to do home energy upgrades with nations. The programs that we had in market to that point required that we send out one of our contractors into the community to do the home energy upgrades for them, and we'd get a lot of closed doors, mistrust of strangers entering the community, mistrust of BC Hydro in particular. So one of the approaches that we took in the pilot was just to work more closely with a handful of nations to kind of understand how they wanted to see that work approached. And what we came out with was like a really great partnership, I think, where we tried to kind of be in the background and just listening to the nation and supporting their needs. So we had the nation really delivering the home energy upgrades in the community. So they decided how to communicate to community members, and they told us what they needed from us. They were the ones that signed up community members to participate in the home energy upgrades. They recruited and hired what we called home energy technicians. So that sort of middle actor that he referred to before, these trusted community members that would go into homes and actually do the assessments and the installations themselves. And we provided the training for them to do that and the salary support for them to be hired in that role. And we provided all the sort of basic energy saving measures, weatherproofing and air sealing and light bulbs and low flow fixtures and clotheslines and things like that. So, the nations then could approach the work at their pace with community members, and we saw really great participation as a result. We saw we were able to get into pretty well every home in the community, in the communities that participated in the pilot. So that, I think, was an example of just ways to overcome that trust barrier. And I mean, it's just one example, and we've got a long way to go as Hydro. We've got a lot of work to do, but that is one aspect of the pilot that's actually become a program offer that we have now within our demand side management portfolio. So we're sort of still working on a lot of other energy efficiency opportunities with Indigenous communities, but maybe I'll leave it there and pass it along to the next person. Thanks, Dee.
Kia ora, Amy. Thank you so much. Also, like 100% Totoko, agree with you on both the trust issues, which we encounter as one of definitely the major barriers, and the need to find those trusted relationships with those trusted community middle actors, which is also quite hard because sometimes they're very hard to reach. That's something I'm finding right now with my own pilot. We are going to hand over to, why did it stop working? Italy. Anna, Simone.
Hello. Hi, everybody. I will speak. Simone will be in the background for questions and everything as well. As she introduced us, Simone and myself are the energy poverty team inside our company and inside our group of energy efficiency. And we are presenting the Italian pilot action that we performed on a European project. We were the leaders of the pilot action in this project, and we were coordinating in detail the Italian pilot action, but also all the pilot actions through the other countries that were Belgium, Finland, Poland, Spain, and the UK. This project lasted from 2017 to 2020. And it was, let's say, divided into two main steps, into phases. The first one was to identify household energy advisors that were some middle actors, let's say, that were educated in the fields of energy, environment, and social sciences with a focus on how to address vulnerable consumers. And these middle actors, these HEAs, were those who had the target to involve vulnerable consumers, to reach them, to build their trust, because one of our main barriers, as was already mentioned, was trust. And to support vulnerable consumers in their day-to-day energy choices, also by raising their awareness, but also by supporting them, for example, in asking for financial aids or to change their energy contract in case it was not the cheapest one, and so on. What they did was to first, what we did was to prepare an education program in which the partners of the project were the teachers. So, for example, we work mostly on technical issues. So we taught how the energy market works, what is energy efficiency, what they can do in their homes. Other partners were more focused on social sciences, so they taught on how to approach a vulnerable consumer, how to deal with them, and so on. And then to identify those potential household energy advisors and to train them. The course was performed partially online, partially, if needed, in person. For example, in Milan, Simone and myself taught part of the course in person to consumers associations that were based in the area of Milan. Once the household energy advisors were trained, they performed the different pilot actions actually in different parts of the country. Some of them tried to involve the vulnerable consumers through energy cafes that were open public events where they were generally discussing about how a house consumes energy, how the energy bill can be read, and how to change the contract, to what were the financial aids available for the whole population. Then these cafes were, let's say, the starting point to try to identify vulnerable consumers and approach them with a dedicated consultancy in one-to-one meetings. Some other HEAs that were coming from already from trusted companies, for example, from consumers associations, or were social workers or teachers in schools, started directly with the one-to-one advice, one-to-one meetings, where they met the families, sometimes at help desks, sometimes at their homes, and tried to, let's say, customize their advice. The case study is focused both on the training of the household energy advisors and on the involvement of the vulnerable consumers in the pilot action. but is focused only on the Italian results. Please, can you go to the next slide?
Yes. Also, I'm going to just do a very quick shout out to somebody who I know is in the audience, and that's Katie Jander, who's a very good friend and also our fairy godmother. The reason why we're using the term middle actor is because of a paper she wrote with Jaap Parak in 2015 that differentiated middle actors from intermediaries by middle actors actually having the agency and capacity to act, whereas intermediaries are seen mostly as go-betweens. And so what you hear from all of our case studies is that we're basically really talking about middle actors who are embedded in the community and who have the trust and the ability to act. So now we're going to the results. Continue, Anna.
Yes, thanks. And the results were quite promising because we registered more than 200 HEAs and we fully trained 122. However, only 23 of them actually performed the actions. So 23 of them met the families in one-to-one meetings. We had more than 7,000 energy users reached with light information, so through energy cafes and public meetings. And we have considered that with the advice that was given to them, they have reached 2% energy savings. And then we had, let's say, the core result of the project that were 618 energy users reached through dedicated consultancy with good average results. We had an energy saving indicator that was taking into account not just energy savings, but also comfort and financial savings that I think have the same importance or are most important for more important for vulnerable consumers, because vulnerable consumers often are already consuming a very low amount of energy because they are saving in every way they can. And this indicator was 5.5%. And a vulnerable empowerment factor equal to 0.4 on a scale of 5. And we tried to analyze why. And the first option that we saw was that some people already had some awareness about the energy sector, or some people didn't understand anything or understood a little of what the consultant told them, but at least they applied the advice, so they were able to save energy, even if their awareness was not so much raised by the action that we performed. However, we consider these not bad results, good results for the energy saving, and not bad results for the vulnerable empowerment factor. It could be negative, so it was positive at least. And as it was already said, trust was one of our issues, and that's why we were very lucky to find some middle actors that were already trusted by the population. For example, as I said, consumers associations, social workers, and teachers. Two other big constraints or barriers that we found were budget and time. Time, because the project had, as most Horizon 2020 or other European project, European Commission funded project have, is that there is a very limited time in which you can carry on the project, and it usually is between 2 and 3 years. Mm-hmm. And if you have a lot of things to do, it's really a very big constraint. For example, it took us 1 year to train all the consultant, and before that we had to build the course, so we had just 1 year to perform the actual pilot actions. And budget, because the budget was quite limited. It was not available to buy home appliances or to pay for any renovation. So we could advise the vulnerable consumers. In some cases, for example, in Belgium, they were able through donations to provide them with very small gadgets like a thermometer or something like that. But we couldn't pay for anything to help them increase their energy efficiency. So these were the three main barriers and constraints that we found: trust, budget, and time. And then there was a fourth issue, that was the location, because of course the project was overall Italy, but the issue was that HEAs were doing the training and doing their action on a voluntary basis. So as a plus to their everyday work, for example, social workers were adding some information about energy to their day-to-day work with the families they were already meeting. So, of course, we couldn't force people to become HEAs in all the parts of Italy. So sometimes we found that in some places we had a lot of HEAs that were performing the actions, for example, in some parts of central Italy near Rome, and in some other areas of Italy were totally uncovered and we didn't have any HEA. Thank you very much, and I pass the mic to someone else.
Grazie mille. There's two things in particular that really stood out. Definitely the issue around overloading those trusted community middle actors who are so important, but that's not the primary mandate, is not energy efficiency or housing. And so to give them something else to do and to train them, it's actually, it's actually really hard. And that's something that we need to overcome somehow by just generally resourcing that sector much more and building those long-term relationships. And then the second thing is I love the energy saving indicator. I am so glad you did that. I'm going to give this to the New Zealand government, because one of the issues that we have here, because the housing stock is so poor, is that it's not about energy savings. It really is. Sometimes they need to use more energy. One of the big behavioral issues we have is that they're underheating their houses. They're not ventilating enough. They are crowding because of the situation that they can't pay their bills. And so they get into these really unhealthy living situations. And so what we actually want them to do is use more energy for heating and for ventilation and figure out a way of how we can do that. So I love that this energy saving indicator takes that into account. That's brilliant. Thank you so much. Portugal, Miguel, tell us about your wonderful case studies, please.
Thank you. It has been an amazing conversation, I feel. So we are from the Nova University of Lisbon, me and my colleagues, João Pedro Gouveia and Pedro Palma, which also contributed to this work. In case you are not very familiar with Portugal, we are in the Iberian Peninsula. We are mostly known for soccer, but we also do other stuff. So regarding energy, which is the topic here today, we are committed until 2050 with climate neutrality, but we have a huge energy poverty problem in Portugal, where 29% of our population might suffer from this situation. And it's the usual culprits. It's low incomes, some of the lower in Europe. It's inefficient buildings, and it's also high energy prices, because also in Portugal, we have a high external dependence on energy. And we just recently started discussing energy poverty in Portugal, like in the last 5 years. And this hard to reach energy concept, users concept, is quite novel. So, but when we look at this concept, we identify ourselves with the concept, because we see that we have a very socio-economic tissue that really drives these vulnerabilities. However, there's not much work done targeting these energy users. So today I'll present two small projects that are connected to the topic, but are not so specific as some of the projects in New Zealand or in the UK that really look at children or look at the elderly. These are more general. So this first one was promoted by the Portuguese Energy Agency, and it provided a comprehensive approach to engage consumers in energy poverty reduction, so to increase energy efficiency. In the first part of the project, an energy poverty vulnerability index that you can see in the figures for winter, summer seasons was created, and to identify and pinpoint the civil parishes that really suffer from these problems. And this index included socio-demographic indicators such as population age or incomes, and it also included the calculation of the energy performance gap. So what Sea was just speaking about of underconsumption. So looking at where people are not consuming as much energy as they actually should. This index was used to select 10 regions that you see in the other picture, where 10 household interviews were conducted, so 10 in each region, to really try to address and to understand what were the vulnerabilities. In the last stage, an energy efficiency manual was given to local authors, and these were conducted energy brigades, so people that went to a lot of people's homes and tried to improve their energy efficiency and address these problems. So a lot has been said about trust, and I would add here the shame that was referred by one of the experts in this project, that these people have a really difficulty times in trying to reach out for help. Sometimes they feel ashamed that they live in these conditions and that they cannot provide sufficient energy services for their families. So this is quite important. And also I would finally add in this case study that it was important not to mention that we were analyzing energy poverty. So it was about comfort, about energy efficiency, not about going to people's houses and calling them energy poor. You can pass to the next one, please.
Thank you. I just want to say a couple of things to that because it's brilliant. And thank you for raising this, Miguel. We also heard the issue of shame, particularly in those Maori and Pacifica communities. There's very much a cultural lens to that. And I think Amy's nodding probably similarly. And you are so right about us needing to be more careful with our terminology because hard to reach, vulnerable, poverty, all of these are putting more stigma on these populations, and that is very much through our usually white middle class lens that comes from this top-down perspective when we're trying to do the right thing, but yet we don't really understand the on-the-ground issues. And that's why it's so important to co-create with those trusted middle actors and get them to figure out, particularly around the engagement strategies and the language, how this is communicated. So again, thank you so much for pointing that out. Also, I just want to say Portugal is now also very well known for being the single most vaccinated country in the world. So go Portugal. Oops, and now I talked and can't get to the next one. What's happening? Okay. Oh, hang on. Here.
Yeah, thank you. So the second case study was focused on small businesses. And in here, it was more of an academic project that looked at exploring the energy saving potential in the small business service sector. So what we normally see as grocery shops, as food services, restaurants, the small businesses that populate neighborhoods in cities and villages. And also to look at the drivers and barriers. So it was the main two goals of the project. And in here, we focused on a single neighborhood. So just one neighborhood in Lisbon, which you can see in the picture. And the goal was to try to work this issue as a community and also to simplify the logistics of the fieldwork. So not going all around Lisbon, doing energy audits in each corner of the city, but try to really take it to the neighborhood scale. So the first step was inventory and mapping of the commerce and services enterprise. So to know what is in the neighborhood, what type of activities they perform. And then of around 100 and something businesses, 47 received energy audits. So at the time we went door to door, face to face, talking to people. Okay, can we have this project? Can we do energy audits in your establishment? And you can see one of the quotations from one of the persons involved in the project. After the first energy audits, it was very easy to do the next one. So people, they know what is going on. They know it's not a trick and we are not looking for money. And they are very interested in this knowledge and in this free service. And they talk to each other. So they know, okay, the person of the restaurant next door did his energy audit. He is satisfied, so I also want to do it. After the audits, there were informal counseling sessions with business owners. And also, as we were working on this as a community, also community level workshops, which bring us to the next quotation, that these workshops occur in festivals of the neighbors. So there was music, there was drinks, and we took the opportunity to do workshops on energy efficiency, on renewable energy, on saving energy. So to really treat the issue as a community. And I feel like this project, as well as the other, they didn't have a very long evaluation outcome. The projects were short, but one of the key outcomes is definitely that, for example, in Telheiras, nowadays, the partnership that brings together the associations of the neighborhood is really treating energy as a key topic. So they are creating a group that is trying to build an energy community. So this was kickstarted by this project all those years ago that brought together people that were concerned about energy efficiency, energy poverty, and renewable energy. And yeah, I think that's what I wanted to tell you about the projects. If you want more information, feel free to I invite you to read the case study analysis, and you also can contact me everywhere. Thank you.
Obrigado. That was brilliant, Miguel. Thank you so much. I think anything works better with music and drinks and food and shared experiences like that. And I think that is something that we probably sometimes forget a little bit, and that if we do co-create and co-design these things with people in the community, they are usually bringing that into it, a sense of fun and that sense of like shared kai, and actually this is a way of how you can get in and build some of that trust, is not just coming in with the figures and the stats, but actually understanding how they live their daily lives and what's important to them. So brilliant. And we are now going to our greatest of them all so far. She did 5 case studies for us, Danielle, in the UK, and they're all brilliant, and I really hope you read all of them if you're interested in this topic, because Danielle really found case studies that look at some very unusual but super important audiences with intersecting vulnerabilities and compounding vulnerabilities. So Danielle, please.
Thanks, C. Yeah, I'm going to do my best, because it is quite the opposite to Miguel's introduction from the Portuguese point of view, in that the UK, shamefully in many ways, has one of the longest histories, if not the longest, in policy, research and practice covering these issues, particularly around energy hardship and social research, examining energy and various elements of that. So we have a long history of trying to fix this and trying to do better, and yet we remain relatively unchanged, and that's with 3 sort of approaches to defining the issue, as well as numerous organizations. That said, it's not all doom and gloom, and like she said, there are some incredible projects that operate at different levels across the UK and are doing some brilliant work. So it's been great to hear from the other panelists, the other case study authors, because obviously we've all been burrowing away putting our own together, and I'm really excited to get stuck into reading those. It's been really nice to go last and to be able to sit back and sort of hear about the other work that's happening. So I'm going to stop rambling a little bit now and try and kind of work my way through them. They are all, I could spend several minutes talking about each one of the projects individually, so I would urge you to go and read them, or get in touch with me if you'd like to have a phone call and chat about any of the projects. I either know the people who've worked on them, or have sort of they stem from NEA, which is where I'm based, and would be happy to talk to more. But kind of the general sort of summary I'm going to give is a bit more cross-cutting, I guess, rather than deep diving into any one of them specifically. So my name is Danielle. I'm Senior Research and Policy Officer, as C mentioned, at National Energy Action, the leading fuel poverty charity in the UK, working across England and Scotland primarily. And we've got a couple of projects from NEA in here, but I'll start with the sort of the big national project. So C had mentioned she'd taken it from 3 different perspectives: industry, government and community. I kind of tried to look at scale a little bit more, and I'll touch on that in a second. So first up was the Big Energy Saving Network, which is exactly as I've written there. It's a nationally led, locally delivered network of energy advice and support services. So it's quite an innovative one. It's been going for a fairly long time in terms of scale as well. It's about 8-9 years in now. Serves some 20,000 people, reaches some 20,000 people each year, and it's quite different because it's fairly built around sort of fairly light touch. And I'll come back to that again as to what depth we need around some of the support that reaches people. And the important thing, I guess, with Big Energy Saving Network is that this national leadership level, we kind of have this tension between whether we want things to be top down or bottom up, but actually there's some strengths and some elements being top down. So the nationally led bit means that it's government funded or levy funded, but the government direct that funding in the right way, and it's coordinated by another national charity we have in the UK called Citizens Advice, and beyond that it's left to the people who know what to do best. So those regional local organizations, a bit like Amy was mentioning, they're given a bit of funding, so some sort of salary support, training is made available, but beyond that, in terms of identifying who best to support and how to go about doing that, it's left to those who who do this day in, day out. So it kind of plugs the gap in that way. And alongside that, sitting alongside most of the case studies that was sort of one of the key findings that I found, was this element of training and training frontline workers, and this idea of how do we make the projects that are in place for a short period of time have some longevity and some sustainability beyond the project end. And frontline worker training was a really, really big element of that. So the other project is an NEA one from a few years ago that was called Warm Minds. It was a collaboration, which again is a real key strength that I found from the analysis, between different charities getting together and working with their set of expertise. So NEA approached this as the fuel poverty or energy poverty experts, working closely with a mental health charity that worked in the northeast of England. And so each brought their set of expertise to the table around how to develop resources, how to target audiences, where trust lay with different elements of the delivery of that program, and using the strengths sort of in those collaborative partnerships, and doing that, not just the audience work from the beginning, but doing that sort of auditing of expertise of who's around the table from the start. So what are we going to bring, whether that's creating the resources or the knowledge that exists in that collaboration, and also highlighting where there might be gaps from the very start of projects. And that's sort of what Warm Minds did. What can't we do, and who else might we need to bring in to help us with that in delivering the project. And Warm Minds is particularly innovative because, as C had mentioned, the sort of balance between physical and mental health is still quite woeful, particularly in the UK literature. And we have more mentions of it, but we're still sort of not understanding the severe and serious implications that energy hardship or energy related issues, being hard to reach in any one of those forms that we've talked about, those overlapping forms of being hard to reach in this context, and the implications that has for mental health, and whether that's the onset of mental health or whether that's the worsening of existing mental health conditions. So this particular project dealt with those with some diagnosed, sort of common diagnosed conditions around autism or anxiety, and depression, but also other things around autism and learning difficulties, as well as dementia and Alzheimer's. Next project, case study, third one, is a project that I just love. I love hearing about it. I loved reading about it. I love reading and writing about it. And so it operated in the Western Isles in the northwest, off the northwest coast of Scotland, specifically targeted at rural and remote communities. And as well as sort of having a goal to deliver that to some of the most vulnerable households. So to provide some context, in the Outer Hebrides, you're more likely to knock on a door that is experiencing fuel poverty than not. And this is for a whole myriad of reasons. So property condition, low income, existing health conditions. So those overlapping vulnerabilities are very much there. But the project kind of took a different approach, and rather than saying, right, we need to go and reach as many households as possible, it built in from the start this goal of strengthening interagency working. So how can we bring together actors who are working on health, housing, income, poverty generally, or hardship in all its various different forms, and how can we strengthen that interagency working? Tiny example of a really good thing that they did in terms of that, and it's written into the case study analysis, is that they had, for a small community across 4 islands, they had members of each organisation sitting across project boards, so that projects knew what other projects were doing. So there was that real opportunity, and this has continued beyond the project completing, opportunity to stop duplicating work. And so they were able to work together, which is what BECC commonly means in Scottish Gaelic, and they were able to move together towards these shared goals and work to that. And energy and tackling energy hardship was just the sort of nub of what they were doing, but it was around this strengthening interagency working. And a particularly important part of that, actually, which is worth noting, is this was a project that focused on how we can better understand the social determinants of health and how we can tackle work around that and work with health actors. So that was about bringing GPs and other health professionals in as referral partners, and how we can really pull together how our homes can be bad and good for our health, and how we can align goals around that. Empowered by Energy is another fantastic project delivered by National Energy Action. It's still running now, it's in its 3rd year. And this project recognised a gap with a very specific group of recent refugees. So in the UK, when you are recently granted refugee status from being an asylum seeker, support is cut within 21 days. So you are then left to navigate not just the complex energy system in the UK, but you're left to navigate the housing system, income, benefits, children in schools, registering for GPs, and all of that support network is stopped within 3 weeks. And so the project recognised that one way in which we could sort of alleviate vulnerability around that was to work with recent refugees. However, really early on, and this is kind of touching on that audience profiling work and the benefits of taking that time or having that time at the beginning of setting up projects that are aiming to maximise effective reach for hard to reach groups, is around understanding that sometimes your definition of the group that you're targeting might need to be broadened or expanded in some way. And this was certainly the case with this project, in that what they were actually trying to do is support people with little or no English. And how might we better support those groups that have come together rather than sort of this fixed definition around recent refugees. Indeed, the project did involve recent refugees, but was broadened to be more inclusive. And the last one, so they were for residential examples, and the last one was drawing on some fantastic work done by Dr. Sam Hampton at ECI and colleagues around focusing on small and medium businesses or SMEs, as we're getting in knots around the definitions. So yeah, I would urge you to go and have a look at this work if you're sort of wanting to look at some transferable mechanisms and resources across different sectors of working with non-residential hard to reach energy users. Like C mentioned, we're not just dealing with low-income households, and this was particularly the case within this project. Another really brilliant thing about this project is it kind of stripped away from these predefined lists of which businesses should we reach and which behaviours should we target, stripped away and really foregrounded the role of psychographics, particularly drawing on psychological theory to understand values. And sort of a driving goal behind this project was not how do we change people's values, but how do we work with existing values to get to where we need to be, which is net zero in the UK and you know, obviously in different targets and ambitions around the world. But yeah, so that's kind of where that's situated. See if you could give me the next slide. I'm going to whiz through these. So all I kind of just wanted to touch on was, this is some of the examples around the project, but I just wanted to give a couple of notes around scale, which I've mentioned a little bit. So things around the hard to reach groups that are focused in the UK chapter sort of vary from that broad. The Big Energy Saving Network was vulnerable energy consumers in the broadest definition, and rural and remote communities, which can mean any number of things, coming right down to some of those narrow ones. So the specific health conditions or recent refugees, and understanding where there's strengths in taking those approaches and where there are limitations and where we might need to be more flexible. In terms of delivery scale, the projects look from those that are national to those in very, very specific areas, working with small locally based charities. And again, understanding that the analysis goes into understanding how delivery and oversight management of these projects at those different scales can again be a good and a bad thing, and understanding some of those tensions and where the strengths lie. And then in terms of reach, so like I've mentioned, the reach is sort of in the tens of thousands, right down to smaller projects where they worked with groups of 8 to 10 people, no less impactful. So the changes that meant that were sort of recorded for some of those groups and households were just as significant. C, could you give me the next slide? And I'm just going to whiz through some of the main findings that sort of cut across. Yeah, so kind of reflecting on all 5 of the case studies and bringing forward some of this, and I'm sure some of this will come up in our discussions of the 3 key questions that follow for my little bit. And indeed feature in the sort of the beast that C was referring to of the literature review that was done in year 1 of the task. So across the case studies, implications of heterogeneity. So no matter how much time we might spend defining groups, once we get into the nitty-gritty of delivery, we realize that groups are different. People have overlapping experiences and vulnerabilities and living situations and goals and dreams and hopes. And it's really sort of leads on to the next bit around a need for flexibility. So this isn't just in terms of delivery of programs, so being flexible as we're delivering it in real time, but also being flexible in terms of how we understand the groups that we're working with, so in terms of definitions. And this can be really like practical examples. So one of the ones that's mentioned is around allowing children into sessions to make it more inclusive and accessible for certain groups in local communities. So when working with refugee groups, they were working with the Tamil mothers, women's group, and women were not attending when they started to uncover why. It was around not having access for children, or not allowing partners in, or not making it, not allowing, but not making it aware that, you know, anyone can come into this space and it's a safe space and to be included. Effectiveness thinking around projects that are person context and in some cases business specific, so really understanding what that contextual factor means for different people and the different programs and projects. Steve's mentioned, so I won't go into too much detail, but around some of the most effective mechanisms were understanding how we change the behavior changes as well, so not just direct contact with households, but how we work with those once removed. Ultimately, the cascade approach, it reaches more like a spider's web, so if we can work with some of those people that have those contacts day in, day out, that reach multiplies very, very quickly, and we start changing some of those cultural practices. Working with new hard to reach groups is challenging. It's time and resource intensive, and this needs to be appreciated and sort of prepared for, I guess. It's tough. And so a lot of the interviews that I'd done and the research that I was reading was sort of unanticipated barriers and challenges that had come up. And a lot of them took more time, and they built in more time into the project. So I guess one sort of recommendation around that would be understanding how that's built into funding mechanisms and systems and streams where challenges are encountered. How do we build in more time to deal with those properly rather than trying to move through them fast? In-depth and lighter touch, sort of these conflicting, do we want services that are in-depth, regular, repeated, or do we want the ones that are lighter touch? The case study analysis in the UK included both. A really interesting thing from the Big Energy Saving Network, which did focus on that lighter touch mechanism support, doesn't necessarily mean lesser impact. So for a lot of people, interactions about energy, whether that's energy advice or whatnot, will be the first time they've ever talked about energy. So that's significant in itself. So not disregarding some of those lighter touch projects, they have a place and a role. Trusted middle actors has been mentioned to death, so I'm not going to go any more into this, but again, sort of echoing some of the other literature around the value of the single point of contact, the role of expertise and the role of trust. There is a sort of balancing or some tensions around whether we're drawing on social and behavioural theory or whether we're drawing on real world insights. I've got internet connection unstable. Can anybody see? Oh, heads are moving, we're good. I'll keep going. So sort of understanding this, are we still good to see?
Yeah. Yep.
I think so. I'm going to keep talking anyway and hope that it's all okay. So some of the projects drew on years and years of expertise around delivering similar sort of schemes and services. Some, like the non-residential example, looked more specifically at behavioural theory, deep entrenched psychological theory. And I think that there's possibly a lot more work that we could do together. So my background's in academia. I'm now probably more heavily rooted in practice and policy. I know that there's great work happening in academia and there's fantastic work happening in policy and practice, and it's still that case of bringing those two together. And I will do the massive plug here, but that's exactly the sort of mission of the Fuel Poverty Research Network in that specific area, is to bring together those voices in the same room. Collaboration is essential. Again, I've talked about it a bit in the past slide, so I won't go into too much more detail. I did want to just spend a second talking about the power of the extra stuff. So the things that we can add into or build into programs. And there were some really brilliant examples of this. So freebies. So I know that Anna had talked about some of the giveaway things around building engagement, getting people into the room to be able to talk about stuff that matters to them. So giving slow cookers or providing radiator foils or blankets or hot water bottles, and being able to take some of that immediate crisis burden away so that you can have some of the conversations around things like switching energy supplier or making changes to your property. Before you get into that deep sort of boring maybe energy stuff, start dealing with some of the things that mean something to people in their real life. And I know that that was picked up in the literature review around having grounded conversations. And another thing on that, the sort of the extra stuff, a couple of ones was the role of translators and being able to have those in projects that work with people with limited English. And another one about having small hardship grants available so that frontline workers who are part of a program of delivery can tap into that to access things like a new cooker or a washing machine, again, to give that breathing space to some of the most extreme examples of working in the residential sector. And evaluation, my day-to-day job is social evaluation, so I'm obviously going to land here as a key finding, but we need more of it. And only two of the examples I included had within their funding written in the capacity to do formalized evaluation programs. However, the absence of a formal evaluation does not mean the lack of evaluation activity. So there's also a role for us to understand where these services and schemes that didn't have the money to prop up an academic institution to do an evaluation, they're still providing, they're still doing some level of evaluation, hence the sort of internal project reports that we've all looked at to build the case study analysis. So a role possibly for us coming together is to understand how we support some of those local organisations in making sense of that data, or having the tools or instruments to collect that data in the first place. Yeah, sort of as a social research, pay it forward, I guess, would be the summing up there. But yeah, really interesting. Thanks very much for including us, C. And I would be happy to continue the conversations with anybody further about the UK contribution.
Loved it. Thank you, Danielle. Thank you, all of our panelists. I've done exactly what Beck asked me not to do, which is to basically let everyone talk about the projects, but then I hope that you guys could get something out of that. I think we've pretty much already hit all of the things we're going to talk about in the 3 questions. One thing that I particularly enjoy about working with international researchers is hearing all these beautiful accents from all around the world. And I hope you enjoyed that as well. And I will carry on with the 3 questions. As I said, we have already touched on a lot of the stuff, but I would really like to invite you guys to put questions into the chat, because I want to spend the next 25 minutes giving you the chance to interrogate us either communally or individually with specific questions. And I totally want to, yes, Amy, Kira Ashby is an absolute legend who has helped us lots, and she's our US national expert. So please start writing some questions in the chat. Until you do, I will go into our own 3 questions. Question 1 was, what engagement strategies did your case studies use? I think we've heard a lot of them already. Here is an example from New Zealand where they did something that was really great, which is empathy mapping and journey mapping. So it's sort of, they did empathy interviews and journey mapping, very detailed, really working with the families via those trusted community actors to figuring out, you know, and this is really going into psychographics here, like what are the issues that they're particularly anxious or stressed about? What is the stuff that is really, really, really stressing them out? Which are some of the pain points that will stop them from being able to listen to like kilowatt hour conversations, and where can overcome some of those pain points. And it was very much a co-creation thing that they did before they even started the pilots. This was just as part of actually getting to figuring out how to do those pilots. We heard the trusted community middle actors are everything. We also heard that they are hard to reach sometimes themselves because they're super under-resourced, they are under the gun with a million things, and energy efficiency usually not on top of their mind. They do need training. Most of us have done work with specific training programs that are geared at home energy advice. In Aotearoa, for example, we have a certified home performance advisor program, but then that has been now recreated through the lens of those community actors and the lens of vulnerable whānau families specifically. So it is much less about the details of energy efficiency technology and stuff, and much more around communicating to them about like, what are the 3 buckets of energy use, and which one are you meant to use more? Heating. Which one are you meant to use less, so you can afford the heating, maybe around appliances and hot water, that kind of stuff. Face-to-face and in-home advice and coaching, if possible. It's expensive, it's resource intensive, but it really works better than anything. It also gives us the chance to really learn much more about the needs and the day-to-day issues that those households and businesses face, which you really can only do when you're there. And it is important to understand compounding and intersecting vulnerabilities, and particularly things around mental health. We have found, as much as mental health causes issues in terms of becoming even more hard to reach, particularly also around understanding some of the communications or the printed work that's put out there. On the other hand, when you do manage to reach them in New Zealand, for example, we've done research where we found that even just putting insulation and ventilation in and clean heating reduced the incidence of domestic violence, it reduced the incidence of depression, like reduced incidence in learning disabilities in school. Like, I mean, this really, really works. It is so important. And yes, Amy, you're so right. Storytelling, humor, fun, figuring out, like most of those, particularly the Indigenous communities or some of those immigrant cultures, there is a lot more richness around storytelling and around the way the intergenerational connections work. And that is something that I think we're sometimes just like, especially from the more English background, we're a bit repressed and don't really understand how to engage with that and a bit uncomfortable with it. And that's why you really need to give the lead to the community actors, because they will, like, you may start singing and it's really cool, like, you know, like be open to listen to what they think is the right way to engage their communities. Obviously, the behaviors usually that were targeted were actually flexible and were more reliant on what those communities needed. But as we also heard from all of our panelists, there is a real issue with not having enough money to actually provide some of the solutions to those households. It's great talking to them in theory about all the stuff that the landlord should do around retrofitting or around, you know, all the things that they should buy in terms of doing secondary glazing or whatever. But if they can't afford it, then that is not really that useful information. So when we do these programs and pilots, it'd be great to not to spend the money on the consultants to come up with the great ideas, but instead to actually give a lot of that money as koha, as we call it in New Zealand, to the community actors you're engaging and to the whānau that you're engaging, to the families themselves or the businesses, and provide them with actual solutions that they can implement straight away. We also found that in most of those cases, the engagement strategies weren't usually based on like behavioral science or theory in depth. The ones that done by academics like Sam in the UK definitely were, but the ones that were actually run by community actors, they were usually based on what they knew worked and the practical knowledge that they have of their communities. And I think what we found is that simple, easy to understand language and messaging that works on the issues that concern those populations is more effective than spending a ton of money on a brilliant social media campaign that does nudging or whatever, or getting them to do pledges, because like it's great to do a pledge, but if they don't have the money or the time or ability to do something, then, you know, it's kind of like a little bit wasted. And around timing of delivery, I think a lot of us found that there was a lot of time taken during the winter months, especially when everyone realized that the homes were terrible and they were freezing and they didn't have enough money to pay for the bills, or the bills came in and they were way too expensive. But it's actually quite hard to engage these people during the summer months when the community actors usually had a bit more freedom and flexibility to do the stuff because everyone's slammed in winter. And so there is still something to do about figuring out how we can get the lag in timing so that not everything is converging when the problem is particularly high. And I assume that is now actually different because in Canada we had these massive heat waves, and even in the UK you had heat waves, Portugal, Italy, of course. The summer months are actually becoming real problems as well around cooling, I assume, and the ability to not be able to afford cooling and to not have the technology, etc. Does anyone else want to add anything to engagement strategies? Did I forget anything that we haven't touched on yet? And does anyone else in the audience have any specific questions or comments to make?
I have one tiny thing on the use of sort of more creative or just different approaches. So yes, craft-based, gamification, these things came up as really effective, particularly for working with different groups. The thing I'd pull out as well is the role of that in evaluation is massively overlooked today. So we do the same evaluation methods. We run surveys and interview people as rigid data collection exercises. And actually it came through on one of the case studies I did that doesn't engage people, so they won't take part in that fundamental component of understanding the sort of the building blocks. So how can we think about more diverse and creative methods in how we evaluate programs to incorporate refugees or migrant, you know, or people with mental health problems? So yeah.
Amy, did you find, you must have found it as well with your Indigenous communities?
Yeah, absolutely. And I've come across, and maybe others are familiar with it, but creative voice as a method of evaluation and engaging people in evaluation. So, you know, trying on those like creative muscles that people have and getting them to sing or draw or craft as a way of telling a story or sharing experience. So.
Oh, that's great. I love that. I need to look into that. In New Zealand, we have a thing called hui, which is basically a gathering. And if you invite people to focus groups, you have much less of a chance to get them there than if you invite them to a hui, because a hui means that everyone is on an equal footing, everyone has a voice, there's going to be food, there's going to be, you know, like a social gathering, and it's a much different like way of doing stuff than if you just go like, I would please like to do a focus group and ask you some questions that I have prepared. So yes, very much totally that. Danielle, does anyone else have any comments or questions around engagement strategies? I realize our audience is very quiet. Come on, ask us some questions. Miguel, what did you find with the businesses, especially around engagement strategies? Did you do some fun stuff? Like, did you have some sangria outside at night?
Yes, in some of the audits, you know, at the time it was using smart meters that were not very smart, so they required about some intensive work to change sockets and measure consumption. And as you get to know people and you go to a coffee house or to a restaurant, they see that you are doing some work and they offer you stuff. So they give you, they have a coffee, or thank you, are you hungry, do you want to eat something? So it really creates that connection between the team that is working and the people that are receiving the team in their space. I'm not sure if in households it also happens, maybe it also happens. But I would also highlight the role of local actors and associations really multiplying this effect. Like if you train these people, then they go to the next one. So it can really multiply the effect of these actions.
Yeah, the role of food is massive. You won't ever be invited into a Pacifica or Maori household and not be, you know, offered some food or drink. And it's, yeah, I think it's also great to support starving PhD students. So, all right. Gail asks, how do you support middle actors if faced with the inability to compensate financially? That is a very good question, Gail. And I think training is definitely one of those things. Training can be very empowering, particularly if the training has been co-created with those kind of community middle actors. So it is, it is from the language and the perspective of them and their clients. What would be even better is if some of that training could be certified, so it could be part of professional development. And I think this is something where we really need to work more with policymakers, particularly on that national level, to embed some of these, like I think Italy, you're agreeing, in New Zealand, definitely the home performance advisor training. I think Danielle, the frontline staff training you guys are doing is probably an example where it is a top-down national thing, and that is very useful. So that is definitely something. And then I think, Gail, the other thing that's really important is to actually tell those stories and also highlight those voices in the community where it has helped them, where it's not about energy efficiency or just simple money savings, but where it's like some of the most heartbreaking stories in New Zealand, like the one I just said before about this child who's now crippled with rheumatic fever for life, is like, we had, when we did the big insulation subsidy, we got letters from old ladies who said that they're so thankful because they can now sleep in their bedroom and don't have to sleep on the floor in front of the oven. Like, that's how they were heating themselves. They had the oven on and they were sleeping in the kitchen on the floor. And like, when you hear stories like that, you know, that is those are the kind of voices that need to be raised up, particularly to industry and policymakers. And hopefully that will loosen some change so that they can actually help the community actors provide some of that real health into those households. Does anyone else want to say something there? Because it's a great question. Anna?
If I may, yeah. As you said, one of the most important things is to build sort of recognized professional figures. For example, our household energy advisors have been recently recognized as a professional figure by one of the Italian regions. So they can add this professional certification to their competencies, and they can also be hired by different entities, for example, local communities, municipalities, regions, and so on, to work as energy advisors for this particular type of institution. And the other thing for us was to try to involve people that were already dealing with hard to reach users and vulnerable users. So they were already receiving a salary for their day-to-day job, and this was just an added competence that was enabling them either to perform their job better, help the people in a better way, but also to maybe useful for their careers if possible. Let's say these were the two things that we found useful with our middle actors, actually.
Right.
We are now trying to have them recognized all over Italy, not just in one region.
Yeah. I'm just gonna crack because I realized that time is running away. I'm gonna skip this one and just gonna very quickly go back to Miguel and Danielle. Did you find that slightly different in the small business sector, or is it relatively similar?
I don't mind. Miguel, do you want to?
I can just say very quickly that it is a bit different, but when we were talking about family businesses, small businesses, I feel it's more similar to households than it is to large industries, or to large companies. So it is a bit different because of the business perspective, but it's quite similar to household problems, I feel.
And I guess especially now with COVID, with the lockdowns, where a lot of small businesses are actually becoming home-based businesses, and there is kind of even more of an overlap between residential and commercial energy use if they're running their businesses or if their contractors running out of their houses, etc. So I think it's becoming more muddled as well.
Yeah, that was a huge thing found in Sam's work in developing in his doctoral work that sort of laid the foundations to this. Anyway, I think the only thing I'd say is similar, so stuff around using what you've got. So whether that's expertise, networks, resources, having people around the table who can support that. So the thing that the Promoting Sustainability in Business project did was sort of use the expertise in developing resources. So they had somebody who could develop an online course, and they had somebody who was great with climate communication, they had somebody who could do really usable printed guides, and so they developed these resources that would meet multiple formats that would meet the needs. And it's kind of, I guess, no different really, the domestic or the non-domestic, in that I heard from somebody who said we can't make projects fit people. We can't make people fit into boxes for the projects. We have to make the projects fit with the people. And I heard exactly the same thing around the businesses, is that we can't sort of go into this expecting to change the values and the principles of the business. We need to find a way to work with those. And that starts with even understanding them. So I think that's kind of where it sits on the engagement strategy. But in the business one, I did hear that I didn't hear somewhere else, was that people valued expertise a little bit more in terms of letting you in, to open the door to you. So how would you understand you don't run a business? You wouldn't understand what it's like to be doing this here. And that seemed to come through much more strongly than talking to people around. I've never heard anybody in any interview say, a household say, you wouldn't know what it's like to be living cold and poor, so I don't want to talk to you. Whereas that kind of came through in the business side.
That's really interesting. Yes. Also, the heterogeneity of small to medium enterprises or businesses is like massive. It's just insane. We have a great question from Clark. When you engage small businesses, were you trying to get them to accomplish project upgrades, or was it more a certain performance target? If so, what was the performance target?
Again, so I can just quickly, so it wasn't the work around promoting sustainability in business was less around this fixed, rigid, target-driven goals, and more about how do we take businesses on a journey. Like it's about changing the values and the cultures and the sort of the not changing, but working within those, rather than saying, you know, we need you to have this lighting system or this boiler or this by X date. And those were part of it. Those might be some of the practical examples in the delivery of the scheme, but they weren't the goals or targets set out in the scheme. I'd urge you, if you're interested in this area, I'd urge you to read anything that's written about this project by Sam and team, because yeah, there's various sort of great angles.
Yeah, Sam Hampton really truly is absolutely in the small business sector. He's done some really, really fantastic work. So yes, thank you, Clark. I'm also going to, Miguel, do you have something to add there? Were there performance targets?
That the project was more about awareness and information than it was about specific targets. But then when the audits were over and we ended the reports, there was this saving potential calculated with a return of investment of less than 3 years. And we really highlighted that saving potential to business. So you really, these measures in less than 3 years, you are going to have your money back. So these ones you should implement. Some of them did, some of them didn't.
Yeah, that is something I definitely heard more also from the business sectors. Generally, they, I mean, they understand return of investment, and they're really looking at that much more than anyone in the household sector would ever do, and the cost benefit analysis. Now, very quickly, we talked a lot about barriers, and we are running out of time, but I just want to highlight some again that were like really, really, really clear. If you're dealing with renters, both in the business or in the residential sector, one of your biggest barriers is going to be your landlords and the split incentive. And very often there's real fear of landlords, like in countries like New Zealand, where we have a massive housing crisis, not just affordable housing, but actually just housing full stop. Anything that could mean that the landlords may kick them out or raise the rent is an absolute no-no. So these whānau are particularly actually afraid of, you know, contacting the landlords or having somebody contact the landlords on their behalf, even if it is basically killing them, like we just heard in that example that I told. Trust is probably one of the biggest issues, particularly if you're dealing with people from different cultures. There's obviously cultural and language issues, but there's also often this underlying distrust against authorities in government, in industry, that is based on multiple generations of bad behavior towards those communities, and that is something that is you know, will take time to overcome. Competing priorities is obviously an issue both for the middle actors that we're trying to deal with, because energy efficiency is hardly ever that primary mandate, but also for the households or businesses. They may already do what they can with energy, but anything else when they're just trying to survive and put food on the table may just that just may not be part of what they can actually spend their limited time on. And that also goes into those mental and physical health issues, which very much compound those problems and are often not understood by the policymakers or program managers who are trying to design these programs. Poor housing stock. Not all countries are as terrible as New Zealand. However, I do know that most of those vulnerable businesses or households do also end up living or operating out of much poorer housing stock than the more wealthy. And then, of course, we do have to acknowledge that these middle actors that we're talking about that are so important are also really hard to reach, and figuring out how to overcome that is really quite an issue. And with the very last minute, I'm just going to go into recommendations, which is you've got to build those trusted relationships and co-design. You've got to try and find the budget to actually pay those middle actors and to train them properly. You've got to clearly define your target audience and behaviors and understand them and like actually target them to their needs rather than your needs. You need to use simple communication methods. Use behavioral science, but mostly rely on your middle actors' practical knowledge of their communities. Do pilot if you can. Definitely try and evaluate, but don't just be stuck on the usual evaluation. We've heard there is many different types of evaluation, like narrative evaluation, that is really important. There's a lot of qualitative stuff that comes back that's really important. Reiterate when needed. Also look at persistence if you can. Tell stories. Do look at it through the non-energy lens if you can. And then in terms of policy, dedicate specific energy efficiency and renewable policy to those hard to reach groups and really understand them. And that is what we want to leave you from the world to the BECC community with love. Thank you so much for joining us. You were all great. Thank you to the panelists. You are absolute stars. Thank you for the great case studies. I hope you read them. They're really fantastic. And see you hopefully in person next time. And give us a call, give us an email, talk to us, and kia ora.